Welcome back to TV5 News at 9, everyone. Joining us this morning, we have Dr. Brian Ye calling in. Dr. Ye, thank you so much for being here. How are you this morning?
Well, I'm doing well. Thank you for having me.
Of course, anytime. We are talking about proton therapy and lung cancer. So first, can you explain to our viewers exactly what lung cancer is?
So cancer is a type of abnormal growth or tumor, but there's two different types of tumors. There's benign tumors or malignant tumors, and malignant tumors are considered to be cancerous. Tumors are abnormal growths in your body. They're considered benign when they stop growing on their own and when they don't spread to other parts of the body. They're considered malignant or cancerous when the growths do not stop on their own and when they have the potential to spread to other parts of the body. And so lung cancer is an abnormal growth that begins in the lungs, but it doesn't stop. It keeps on growing. It can cause lung damage. And it can also spread to other parts of the body and cause damage to other parts of the body.
Wow, okay, so it's good to know exactly what that is. Thank you. So who would be maybe at greatest risk for lung cancer?
So the people at greatest risk for lung cancer are those who have a history or are current tobacco smokers. In the general public, for people who do not smoke, the risk of lung cancer is about 3 in 1,000 or about 0.3%. Unfortunately, if you have a history of smoking, that increases your chances by 30 times. So it goes from 0.3% to about 9 or 10%. So about 9 to 10% of people who smoke will develop lung cancer.
Dr. Ye, just out of curiosity, say someone was a smoker back then, they've quit. Do you think they're still at risk?
So we believe that after about 15 years, so a smoker who's quit, for the first 15 years after they stop smoking, there's still an increased risk of developing lung cancer. But after 15 years, the risk actually goes back to about the same as the general public.
Okay, thank you for answering that.
So quitting smoking, the big picture is that quitting smoking does help.
Yeah, okay, yes, of course. So why might proton therapy be a good treatment option for lung cancer?
So proton therapy is a special type of radiation therapy that's more focused. Traditional radiation therapy is X-ray therapy, and that goes through your body. Proton therapy is like a marble traveling in water. It goes a certain distance in your body, and then it stops, so it doesn't go out the other end. Because of this more focused aspect of proton therapy, it's more precise, and there's less damage to normal tissue. If you don't mind, I can show you a picture of proton therapy. Here on the right is a lung cancer being treated with proton therapy. On the left is a patient being treated with X-ray therapy.
Okay.
And you can notice here, with the proton therapy patient, I'm treating, this is the patient on the right, I'm treating with a beam coming from here, from the back. Actually, everything in medical imaging is flipped left and right. So actually, this beam here is actually coming from the right sort of posterior back part of the patient. This beam here is coming from the right front part of the patient. We can see how the beams come in. They treat the tumor, which is sort of this red area here, but they stop. They don't go the other end. So the left lung, this black area here, doesn't get any radiation at all.
Yeah.
And on the left side of this slide, I have a picture of the same patient being treated with X-ray therapy. You can see here, the beams just go through the patient. So the beams come in, and they go out the other end. And because of that, there's more radiation dose to the lung, and especially to the left lung. So proton therapy is a newer form of radiation therapy. It's more focused, it's more precise, and we're able to treat cancers such as lung cancer. Lung cancer is not the only cancer that we treat, but we can treat cancers like lung cancer with less damage to normal tissue.
And that is pretty amazing. I thank you for the visual representation of that. It always helps me learn. So how can patients find out if proton therapy is the right treatment option for them?
So if anyone is interested in knowing whether or not proton therapies are true for them, the best is to give us a call. Our phone number here is area code 855. It's MyProton. It's MyProton. Or you can go to our website at mclaren.org /proton treatment.
Very good. Dr. Ye, anything else you would like to add?
No, thank you so much for having me.
Absolutely, my pleasure. Thank you again. And for those of you at home, you can find information by going to the Hot Links section on our website, WNEM.com.